pediatric patient is a child ranging in age from birth to 18 years old, and due to privacy laws, specific details about this patient, including their vaccination status, cannot be released. With that in mind, we will now take your questions. In fact, we will allow 2 questions to start and come back around when we get to the bottom of the list. And our first question belongs to Graham Kilmer of Urban Milwaukee. Graham? Urban Milwaukee? Okay, we'll try to come back to Graham. Our next question belongs to Eric Gunn from Wisconsin Examiner. Eric. Once we admit Eric to the call, and he should be joining us shortly, as is Graham. Eric Gunn, Wisconsin Examiner, do you have a question?
Yes, I do. Thank you very much. And if I missed something at the very beginning, my apologies, but is the fact that a death has occurred in this particular season outside the normal course of a typical flu season, or not at this point?
Well, Eric, unfortunately, we've had pediatric flu deaths every year since it became reportable back in, I believe, 2004, if I'm not mistaken. We've had as few as 1. We've had as many as 6. So it's not outside the norm that has happened. But regardless, it's a tragedy that happened. And we give our sympathy to the family and friends of this child. It's happened. It should not have happened. We wish it would not have happened, especially after the holiday season. So again, our sympathies go out to the family and friends of this particular child.
You have a follow-up, Eric?
Yeah. What is your advice to families and others to avoid this repeating?
The big thing is to get vaccinated. I mean, vaccination is the best way to prevent complications like hospitalizations and, in this case, unfortunately, death. If you have not been vaccinated, I would strongly suggest that you consider at this particular point, not only for the person itself, but for those people who are around you. I mean, if people have relatives in long-term care facilities or any kind of children or family members who have underlying illnesses who may have complications from flu, think about getting vaccinated. Again, not for yourself, but also for the people who are around you to try to protect them from suffering from any kind of complications.
Thank you. Now to David Wahlberg from the Wisconsin State Journal. David?
Yeah, hi, thank you. Can you say what age the child was and what region of the state or county they're from?
As far as age, it's under 18. It's a pediatric death. We don't want to give specifics. We do want to allow privacy to the family as much as we possibly can. As far as the region, I believe we said it was in the northern region of Wisconsin. That's our northern public health regions.
Okay.
And another question, David?
Yeah, can you talk about the level of flu, RSV, and COVID-19 activity at this point this year and how that compares to what we typically see at this point in the season?
Yeah, I can. As far as the influenza activity, it's still on the increase, although we are starting to see it potentially level off a little bit, which is good news. It did rise very quickly over the past few weeks. But according to some of my colleagues from other Midwest states, and we just had a meeting less than an hour ago, some of the other colleagues in the Midwest are seeing declines. We are not seeing a decline yet, but we are hoping that within the next few weeks, we will see a decline in influenza activity. But nonetheless, it does remain high at this point. Ours in the way as well. It's just a little too early to tell. Hopefully within the next couple of weeks, we'll have a much better idea of the activity for both influenza and RSV. COVID seems to be going down. That's good news anyway. I mean, we're still seeing it across the board for all ages for COVID. But right now, we're optimistic that we're close to, if not at the peak of activity for all three of them. We'll know more in the next week or two, David.
Thank you. Now to Cameron Kelly from NBC 15 in Madison. Cameron?
Hi there. The question I have is, when was the first pediatric influenza death last year?
I believe it was in the first part of 2024, around January. I'm not positive on that right now, Cameron, but that's my recollection that it happened actually in 2024 with our first reported pediatric death.
And we can get
About
that
the same time
information.
as this year, only 1 year ago. So
Yeah. We'll get that detail for you, Cameron. Do you have another question?
No, thank you. Thank you so much.
Thank you. Now to Graham Kilmer from Urban Milwaukee. Graham, have you joined us?
Yes, I'm here. Are pediatric patients more at risk for complications with influenza than adults? And is there any specific illness or anything else that tends to accompany influenza complications, like a pre-existing illness?
yes, the children under 5 are at higher risk for complications from influenza and RSV for that matter, and COVID, just because of their age. But also pediatric hospitalizations if they have any kind of underlying illnesses, whether it's diabetes, asthma, and that's one of the reasons why we really are pushing people to know what diseases potentially could cause complications or lead to complications, get those people vaccinated. Graham, if you could just repeat your second question, please.
Oh, those are actually both my questions. But my second question would be, does DHS have a sort of average or number for how many pediatric influenza deaths?
Again, it ranges from 1 to about 6. We only had 2 last year, which is good. Unfortunately, we wish it was 0. We haven't had that 0 case since it became reportable back in 2004. But on the average, we do. All I can really say is that we do average, at least 1 to 2 cases, unfortunately, every year. The 1 year that we did have the high number was a year where I think it was in 2017-18, where we had 6 cases, and that was what CDC is calling potentially one of the worst influenza seasons in the past 40 years. We're hoping we don't see that again.
Is there anything that DHS or other healthcare partners monitors when trying to determine if influenza is going to be bad, like a particular strain or variant or even?
Yeah, we do. DHS works in conjunction with CDC to get specimens in. They do sequencing, they do subtyping, they can run all these different molecular tests to see if there's a vaccine match. We're optimistic that it's going to be a good match this year, but those numbers don't come out, Graham, until the middle of February. But it's a collaboration of state laboratory, the Department of Health Services, the CDC, all working together in conjunction also with the World Health Organization to get these numbers and to really make the determination as to how well the vaccine is working. And I'm sure they're thinking about vaccines for next year as well.
Thank you, Graham. Now, Eric Gunn, do you have another question?
Yes, I know you said for privacy concerns, you didn't want to give too much detail about the pediatric death, but can you narrow the age a little bit? Were we talking someone, you mentioned that under 5 has a particularly high risk. Can you tell us whether it was at least somebody under 5 or give some other kind of range of age beyond just simply under 18?
Unfortunately, I can't give you much more information on that, Eric, but it was under 18. We can say that the child did have underlying illnesses that could potentially lead to complications from the flu. That's probably all I can really say about the case right now.
Another question I have is, in the last year, there've been, I think, a couple of occasions or more where DHS has called attention to the declining vaccination rates, and particularly in children, if memory serves. And I'm wondering where we stand. Has there been any kind of turnaround in that since the last time you all went public on this issue? I think, last year, on several occasions.
Unfortunately, our rates continue to decline overall for influenza vaccinations. And this is about 5 years in a row. But actually, pre-pandemic was the last time we had our highest numbers, and that was, I believe, 40%. We're running at 31% statewide right now, which is disappointing. It's a little bit lower than last year, but it continues that decline. It is frustrating because we want to get this message out to people as to the complications and what can happen if the person who is at high risk does come down with complications. Unfortunately, we have this pediatric death. Also, the numbers for the 0 to 4 population and 5 to 17 are in the 20s, 29% and 22% respectively. That's much lower than what we would like to see at this particular point. But you bring up a very good point, Eric. Thank you.
Thank you. And now to David Wahlberg from the Wisconsin State Journal. David?
Yeah, for flu vaccination, and then also it looks like for COVID vaccination, it's about 16% of state residents have gotten a shot recently. And for RSV, it's about 22% of those over 60. How do you, putting all those together, what does that say about vaccination coverage and how we're doing as a state?
Well, obviously, we're very disappointed with the numbers. We were hoping that they were going to be much higher than what they are. We continue to work as hard as we can to get the message out, not only to get the vaccination, but why to get the vaccination, who you're going to protect, the person who's being vaccinated, the people who are around you. We try very hard to get that message out through public service announcements and things like this, the media evaluators, about the importance of vaccine, that the best way to really curb influenza activity is to get vaccinated, number one. Number two, to practice your good hygiene with your coughing into your sleeve, sneezing into a tissue, washing your hands, giving yourself time to heal if you are become sick. But overall, I mean, we wish the numbers were much higher than what they would be, but unfortunately, we're still on a bit of a decline, which is very unfortunate.
Another question, David?
Yeah, I guess, can you explain why telling us whether this child who died was vaccinated against flu or not would violate that person's privacy?
Well, that's our policy over here at the Department of Health Services. We do everything we can to try to protect the privacy of the child and the child's family. They're obviously going through a very grieving period at this particular point. And that is what we have determined to be the best way, one of the best ways to really ensure the privacy of this child and the family is to release limited information. We don't want to keep people, we don't want to hide things from anybody. But we have that particular policy. We've had that policy here at the state for many years.
But how would it identify the person?
What we don't want is to say if the child was not vaccinated and if the child had been, that it'd still be alive. We don't want to give any kind of things that might be misleading to people as well. So we just have chosen to keep the privacy of this child and the family. And one of the ways is to not release any of the information about vaccination.
And also, David, it is their personal health information.
Personal health information. Thank you, Jennifer.
Graham Kilmer from Urban Milwaukee, do you have another question?
Not at this moment. Thank you.
Thank you. Back to Eric Gunn from Wisconsin Examiner.
Thanks. I believe we're covered at this point.
Thank you. Any other questions, David Wahlberg?
No, I'm good. Thanks.
Thank you. And Cameron Kelly, did you have an additional question?
I do not. Thank you.
Okay, well, that will conclude today's media availability. Our thanks to Tom Hoff and all of you for participating. Any follow-up questions may be directed to DHS Media. And for more information on respiratory viruses, you can find those on the DHS website. Thank you and have a good afternoon.